Virtually everybody in this country has been touched by cancer.
If you haven't had it yourself, you have somebody you love or care about who has had it and has dealt with it. Lynch syndrome in my family was discovered 12 years ago. There's an 80 to 90% lifetime risk of digestive tract cancer. In my mind, it was not if, it's when and which one.
At one of our early appointments, I said, look, I see the 5-year survival rate is 14%. I'm 40 years old, I have 2 young kids, a young wife, I'm just starting my career. I don't like this at all.
I knew that I was terminal, I knew that I was stage 4, but nobody had ever been able to tell me, do I have 6 months left, do I have 6 weeks?
It just felt like my world just stopped. Everything else outside of that just seemed to keep rolling.
I only waited a year before being tested again. They were able to catch my prostate cancer before it had spread any further. Now, what if I had waited 2 years? 3 years, or whatever? I would have been in a world of trouble.
I was in medical school in the late 70s. At that time, there were 4 or 5 drugs available for most all cancers. So in my lifetime, I've seen a transformation of the disease from, just barely willing to mention the word cancer to now facing it head on with all sorts of therapies, targeted drug therapies and immune therapy. Very, very exciting time.
I do believe there is an opportunity for us to get cancer treatable, curable, or at least into a position where we treat it like a chronic condition, something you live with versus something you die with.
I knew my situation was dire, and that really put me on the path of, I'm going to research this, I'm going to find a clinical trial, and that directed me into the path where I ended up landing.
Basic science is required for the understanding and the cures of cancer. Just as you need to understand how an engine works to fix a car, you really need to understand how a cell works. So it's very, very important that we continue to fuel basic science. As we've learned those things, notice the plethora of drugs that have appeared on the marketplace, targeting things like angiogenesis, immune evasion, and look at the responses we have in things like brain tumors and lung cancers and colon cancer, where we were never seeing these kinds of responses. So fundamental discovery is at the heart of it all.
The chances of the chemo solving this problem were pretty slim. That I knew. So a clinical trial on something that might address it seemed to me to be the best alternative.
I felt like I was just going down there every 3 weeks, and they were giving me a drug, and I was going home and living my life. It worked pretty fast, too. I started in October, had my first scan a couple weeks before Christmas, and they said everything shrunk by 90%. I was like, what? 2 scans later, they said no evidence of disease.
I'm sitting in the chemo chair reading over these scans, and I had like 5 or 6 tumors in different spots. As I'm reading this report, it said kidney resolved, and it was resolved, 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 resolved. And I said, am I cancer-free? I said, are all my tumors gone? And he said, yes. That moment was one of the most powerful moments in my whole entire life.
We want to see that kind of progress across the board. Every family in America is touched by these major diseases and illnesses. So we're investing in ourselves, we're investing in the family that is America.
Today, we all know someone living successfully with cancer or cured of cancer.
We're able now to do a kind of clinical trials that weren't possible 10 years ago because of the nature of what is now known. That could only have happened through the research that's been done to date, and there's much more to do.
We need to be making an investment totally apart from all of the humanitarian and public health concerns. We need to be making a real investment in scientific and biomedical research and advancement because it's essential to who we are.
Simply said, we can't do it alone. And with inflation, we're actually getting about 75 cents on every dollar that's provided versus the dollar 15 years ago. So in fact, we have less buying power.
Basic medical research is critical to the advancement of discoveries. So there is an important role for the federal government to invest in basic research. As advanced as they seem to be now, it's only going to get better.
Research takes a long time. I'm on this drug, Lartruvo, I could only imagine how many years of research went into this drug. They weren't thinking, I'm going to cure people who have leiomyosarcoma of the bone. They were doing basic research.
The PARP inhibitor that I'm on was started in development 20 plus years ago. And it just now, in 2017, was approved.
The drug that I was on just didn't fix my cancer. It's fixing other types of cancers, and that's only one drug. Immunotherapy is a real breakthrough. I mean, they're so close to conquering this thing and keep the funding going, and let's get this thing knocked out of the way.
Without the kind of research that builds on the knowledge that we have now, that continues to find the new opportunities for solutions, we will never find them. And that's not acceptable. We have to do that. We have to.